Hello, everyone, and thank you so much for joining us for Spirit, the stimulating program initiative for retirees that inspires thought. I'm Judi Steinig, Senior Director and host for Spirit. The OU started Spirit several years ago as an on-site program, and now we're happy to present it as an online program for retirees, not yet retirees, baby boomers, empty nesters, sandwich generation parents, and seniors, everyone who's looking for educational, intellectual, and spiritual growth. For over 6 years now, Spirit continues to be a wonderful way for everyone to connect and learn together in a virtual setting. Before I introduce today's program, I just want to let everyone know that next week, Spirit will be off for a week, but we'll be continuing on 2 weeks from today. And anybody who is joining us today will be getting all the information for the upcoming programs in our recording email. So you don't have to ask us for the recording. With God's help, you'll have it later on today with any other information that's important to you, which it will be important. Plus, by the way, there's information that will be coming about a survey from one of our other departments called Living Smarter Jewish. If you recall, we've had a few programs from Living Smarter Jewish that offer financial coaching. It's a very, very good program for anybody in the spirit demographic, plus something to tell any of your children and grandchildren about. So right now, they're looking to do a survey to see, it's an anonymous survey to see how everybody is doing, within the religious spectrum. So you'll be seeing that later on. So whoever can fill it out, I did it, takes maybe about 10 minutes, but the information is really very much appreciated. Today's program is called Waiting for Grandparenthood. And we are so happy to welcome to the Spirit Forum Kenzi Locks, who's an LCSW and HWC, and Dr. Marian Getzler-Kramer. The program was put together by Gila Muskin Block and from the entire Yesh Tikva organization. And Kenzi will be telling us a lot about that. So we want to thank everyone for joining us. And it's my honor to turn the Spirit Forum over to Kenzi Locks and Dr. Marian Getzler-Kramer. Thank you, everyone.
Thank you so much for having us, and thank you everyone for being here. We're so happy to be here with you. I am, as Judi said, I'm Kenzi Locks. I'm the Director of Program and Educational Development at Yesh Tikva. We are a nonprofit, a Jewish infertility support organization nonprofit dedicated to supporting individuals and couples navigating infertility, pregnancy loss, and any other family building challenges on their way to parenthood. We do this through supportive spaces, one-on-one mentorship, lots of educational resources, professional training, community awareness initiatives like this, as well as advocacy. And our goal is always to make sure that no one has to face these experiences alone. We're rooted in compassion, education, and emotional support. We serve people across all Jewish backgrounds and family building pathways while also helping communities, rabbis, mental health professionals, and loved ones better understand the complex realities of reproductive grief and infertility. So that's a very long way of saying we're here for folks who are struggling to become parents or become parents again for a myriad of reasons, as well as all of those who are around them and support them. So today, like Judi said, we are here to discuss grandparents in waiting, whether you are a grandparent in waiting or you are a grandparent and perhaps one of your other children is not yet a parent and hoping to be, or you have friends or folks in your community who are in this place of waiting to be a grandparent, or you just thought this was an interesting topic. We're just glad you're here. And so we don't have any kind of a formal PowerPoint presentation. This is a sensitive and often very emotional subject. And so really we are going to have a conversation, I would say, with each other and with you. And the chat is there for questions if you need. And I hope to be periodically glancing and adding in if there's anything, that we should get more into. But is it okay if I call you Marian here? Would you like to be Dr.? I was
Yeah.
gonna say, I always call you Marian. Marian, I'm just gonna introduce that you run our grandparents in waiting supportive space every month or every other month, depending kind of on how we are.
Oh,
But
yeah.
You are our resident expert, I would say, in this, in the emotional complexity of what it's like to be waiting for grandparenthood. So something to sort of start with, I think is, and Marian, please like dive in at any moment, but really I was thinking we could maybe start with sort of the invisibility of a grandparent in waiting.
Kenzi, I'm going to just interrupt you for one
Yeah.
second to say one thing, which is that it's exciting that Yesh Tikva, I think, has recognized grandparents as a group of people who need services. It's a very underserved group. As a graduate of a grandparent in waiting myself, I can say that it was very hard to find resources that were helpful. And I think as we get older, we recognize that an issue that's confronting one person or a family really affects everybody in the family. So just, thanks to Yesh Tikva for recognizing that that is a cohort of people that really, I think, there's a shortage of resources for them. And so wonderful that you've, created educational resources and supportive spaces for them. It's unusual.
Thank you. I mean, Marian's not giving herself enough credit. She's a huge part of the creation of all the resources and spaces. So I just want to give you that, give you your roses because we appreciate you and everything you've done. Um, so I think that really, though, that really lends into kind of this invisibility of grandparents in waiting, right? Like you just said, there's not a lot of resources, there's not a lot of spaces. Thankfully, over the years and decades, there has been way more recognition of how infertility affects the people who are going through the infertility themselves, but not often does it show the ripple effects to their parents, and how it affects, the folks above them who are now also along for the ride in some way or another. And they, there's potentially very private grieving taking place while also trying to be supportive and appropriate with your children as well as, those around you. Um, and so I'm curious, Marian, as somebody who's run the group and as you said, a graduate of being a grandparent and waiting yourself, what would you sort of say about the invisibility of this? Like, I feel like I need to say status because I feel like people kind of take their, becoming a grandparent. It's a milestone. It's exciting. And, to be in that waiting space, whether with any children or some children, it's hard.
Yeah, I think parenting adult children in general has many challenges that none of us expected or were ready for. There's lots of literature on parenting young children. There's lots of ways to get that pacifier away from your 4-year-old, which seems so overwhelming when you're going through it. But there's not that much about being a parent of an adult child. And you do remain a parent even when your children are adults. You don't necessarily see their struggles as upfront as you do when a 4-year-old comes home crying because they weren't invited to a birthday party and their world is collapsing. And the other very important piece I think is that you're not only dealing with your own child, you're dealing with your child's partner. And the relationship you have with your child's partner is often different than the relationship you have with your own child. So you're very much in a back seat, but you're watching carefully and you're hurting, knowing that your child is hurting, and there's no instruction manual, and there's no way to know where it's going, and it's not necessarily your story to tell, so you don't necessarily want to share it with your own friends. So it's very uncharted territory, I would say, and it can be a very difficult place to be.
Yeah, for sure. And I think part of that like difficult place that sometimes is happening is like there's some internal editing that has to take place of like, well, should I ask? Should I bring it up? Should I not bring it up? Has it been too long since I brought it up? Do they think I don't care? Am I saying too much? Am I saying too little? I've heard the description of like feeling like, walking on eggshells because they know it's a sensitive subject. I'm curious if that's been your experience in, the group, in your own personal experience, but like how common would you say that is, that feeling?
I think that is a huge piece. You want to give your children the understanding that you care deeply while respecting their privacy and their boundaries, and really responding to the feedback that you're getting from them, which is hard, which is always hard and is doubly hard in a situation that's so sensitive. And as a lot of, kids will say to their parents, if we weren't having trouble and we were trying to get pregnant, you wouldn't know about it. You wouldn't be with us during that time. So to have to talk about this or feel that people are aware of it can be very painful and complicated for, a couple that's going through it. And you don't really know. You're always assessing yourself as to whether or not what you're saying is okay, is not okay. Do you recognize how hard it might be to be at a Seder where there are other grandchildren? Do you not recognize that? How do you show support in a way that your kids can accept it without feeling like you're overstepping your bounds and being invasive?
Yeah. Do you have any tips and tricks or advice on that specifically? Because I think that's something that I know I get asked a bit. I tend to be working more with the folks who are actively going through infertility, who are talking about, I need to talk to my parents, or I need to figure out how to help them help me, essentially, or put in a boundary and figure this out. And so I have my kind of tips and tricks for that side of how to, ask for support or set up yourself for success to kind of continue having a strong relationship. But I'm so curious about your side of things.
I wish there was a prescription. It would be so wonderful if you could write something.
Everybody could be the
This
same.
works for everybody.
Yes.
But I think, it's an extension of how you parent your kids throughout their lives, and every relationship is different. So what works in one relationship doesn't necessarily work in another relationship. And I think what's really important is to be paying attention to how your words are landing. Even if you think you found the perfect script, it may not be the perfect script. And to be able to say that, I'm sorry if what I said wasn't helpful or was hurtful, and to be able to have that conversation with your child. Sometimes Oftentimes the couple themselves doesn't know what they need, so they can't tell you how to support them because they don't know what that support looks like themselves. So it's a constant evolution. It also, I think, depends a lot on the cycle and where somebody is in their treatment, where if they're waiting for a phone call or they're waiting to get results, or, it's very different. So I think that, and you don't necessarily know that. They don't necessarily share, nor should they necessarily share that with you. So there's a lot of, I think, assessing and reevaluating, and I think that there are some programs now that actually offer mentorship for grandparents, where they'll pair grandparents with the grandparents who have, been through this. And if you can find a person that you feel you can speak to, that's helpful too. And often your own spouse and you, the other grandparent in waiting, or your own other partner, may not be in the same place or handle things the same way either. So I think it requires a lot of respect for where people are and how they handle things, and constantly sort of self-assessing what you think you're doing, how well that's working. And also know that I think the hardest thing is you can't solve it. And
Yeah.
that's really painful for a parent at any stage. You can't solve this, for your child.
I think that's such an important point. And something that maybe I should have started with is infertility affects 1 in 6 adults of reproductive age. Like, this isn't uncommon, and it's a huge field of medicine and mental health. And, science is breaking walls down all the time. And also, this is a very, very hard journey. And I would say, like, while we can't say, hey, this will work for everybody's, relationship with their child, there are certain things that we typically advise against, I would say. Would you agree? But I think, like, giving lots of advice tends to be the first one that we hear is really hard for folks going through it, to be on the receiving end of, well, my neighbor's friend's hairdresser's daughter did this and it worked, or I saw this commercial for this, and have you thought about doing this vitamin? Um, and that, I think, tends to land typically, in a harder way for those who are going through a difficult time. Just, I can't paint with the complete broad brush of 100%, but that tends to be what comes up of like people keep giving me advice that I just like, I'm thinking about this all the time already. And it can feel pressuring to have to, sort of say thank you, no thank you quite a lot of the time. But I'm curious if that's been your experience or if there's anything else that you would sort of advise.
I think what goes along with that is that you don't want to show your children or indicate to them that you doubt their competence.
Right, right.
The doctor and whoever they've chosen is not, good enough. You really want them to feel confident in their journey together, and your support staff at best. You're not driving the bus, and I think that's really important. And I think, Kenzie, you can correct me if you think I'm wrong, but I think most people who are on this journey are working really hard to get the best help and to do it the best, way they can. No one slacks in this journey. It's very, very intense. And I think to show any doubt is destructive to the couple and to the relationship.
I think that's such a really good point and a hard one to make because I don't think folks are giving advice because I think it's like you said, they want to help, they want to fix. I don't, and I think also, and this is again, I know you and I are queens of correct me if I'm wrong, but I think from like the dynamic of you're a parent who wants to help your child, right? You spend all their lives helping, and then you're slowly pulling back as they grow, but it can be hard. I mean, it can be when you were saying a 4-year-old coming home and crying over a birthday party. I have a 4-year-old who just came home crying over a birthday party. I am not a grandparent. My oldest is 4, and so, but I also know that I want to fix everything, and so to
And that doesn't go away when you have older
it
kids.
doesn't. My own parents tell me the same. They're like, "Oh gosh, we just like to watch your child struggle, right?" And to watch them struggle with something that is so huge and so all-encompassing. I completely respect and understand the desire to just step in any way you can, whether that's advice, whether that's like full-blown, let me call doctors for you. I've seen the range. Um, and so I understand it. And also I appreciate that you're saying like what you said of it can completely unintentionally convey that they don't know what they're doing or they're missing something. And like you also said, it's the people who are getting themselves through treatment are often incredibly competent adults in every last area of their lives. And this is the one major thing that they can't control. They can't make this happen faster um, necessarily than they already are. They're often consulting with some of the top doctors in the world. This is a really difficult, medical field. Um,
I think there's a huge sense of helplessness on their part and on your part, and we tend to absorb our kids' pain. And that's okay, but we can't expect them to absorb ours. I think it's really important for parents not to expect their children to take on their pain. That's not their role. And I think that can be hard to not let your child in on what you're going through, but the truth is that's not their problem or their issue. You're there to help them and support them. They're really not there to support you. And again, I think all of this is done with the best of intentions. Certainly no parent goes into this with anything other than the best of intentions and the desire to help in whatever that way they can. But it's unnavigated territory for many of us, and you don't know what that looks like. So, I would say that that's a big one, to not expect them to help you through it.
No, and I love the term the kvetching order of I didn't create the term, it was created. But the idea that, whoever is going through the whatever it is, the really hard thing, the diagnosis, the job loss, any major, life altering event, they're at the center of the circle. And then as you get further out, those folks are pouring support in to the center and they're receiving support from the outside. And so I know that you did explain like it is their journey, it is, their private story, but finding if you need support, accessing it through maybe more professional channels like a therapist or a support group or something of that nature where you can talk about the pain of I want to be a grandparent or I want to support my child and their spouse, but it's not quite how I thought I could, or I'm not sure what to do. Because I think it's incredibly valid to feel that pain, and also trying to navigate how not to make it your child or their spouse's issue can be really hard because sometimes comments just come out. I will say, like I've heard some comments through the other end of it of oh, my mom said that, they might as well plan a vacation because they know that, we're not going to have a baby in the next year or all their friends are showing all their baby pictures and they don't have any, all their grandbaby pictures and they don't have anything to show. Um, and it's I don't, and these adult children are not saying, oh, they're doing this maliciously by any means, but often what we hear is they are hyper aware that their parents are not grandparents or not grandparents, at least to them, to their specific child. And that they feel that, especially ones who have a close relationship. We've heard, they'd be amazing grandparents. And I want that for them. Or my parents are aging. And I feel that they're, every year that goes by, that's another year that my child won't have with that person. And like that pressure is so real, and painful. And so then to kind of hear any kind of a remark about the fact that their parent is feeling that loss too, it doesn't feel necessarily like, okay, well, we're in the loss together. I'm sorry if you can hear my dog. She's very excited. But that it doesn't feel like, oh, we're all in this pain together. It feels like I am creating the pain for my parent and, by not being able to give them this child.
I think, Kenzie, something you said before is relevant also, not only when your child is going through it, but if you have friends whose children are going through it. You mentioned, showing pictures, and it's so much a part of our culture, families and children and grandchildren. And I think we don't always recognize, or we're not always sensitive to the fact that we may well be sitting with somebody who doesn't have grandchildren. And that is a place I think that we can be helpful to other people by having a sensitivity of what that might be like, that talking to somebody about your 15 grandchildren coming for Purim doesn't always feel good to someone who doesn't have grandchildren or who doesn't have grandchildren from a child they would want to. And I think that is again a sensitivity that's important to develop. So if you're not dealing with this with your own, if you're fortunate enough not to be dealing with this with your own child, just to recognize that you may have people in your world who are dealing with this, who are not announcing that they're dealing with this, but who are pained by the conversations that they can't take part in and that don't feel comfortable for them, to be sitting around.
And I would say whether that's because their child's going through infertility or they aren't married yet, they haven't come to this place for whatever reason, it still can be very, very painful. And I imagine that we can all sort of take a moment of empathy if there has been a time where it feels like everyone around us is a step ahead, right? And how it feels to be the only one in the room, who's not something yet. I personally was a parent a few years after a lot of my circle, and I would sit there listening to them all talk about potty training, and I'm sitting there going, I have nothing to contribute to this conversation. And it was and I just want to put folks in that place of, if you realize that everyone is talking about their grandchildren in a space and there's one person who is not, something might be going on for them. And it can be such a meaningful thing to change a topic to something that everyone can engage with. Um, and and also I would say on that side too, is if your friend does come to you and says that their child is going through something, um, kind of how would you support them, would you say, Marian? And then also by extension, sort of supporting that person's child in certain ways by kind of how you show up for your friend.
I think the thing you don't want to do is promise something you can't promise. You don't want to go through it's going to be okay. I know it's going to be okay, because you don't. And that's it's not helpful to someone when someone promises that. I think it's really a lot about listening, just letting a person talk. If they've chosen you to open up to, that's saying something about the relationship they have with you and the connection they have with you. And I think listening and being empathic and making yourself available is really the most important thing that you can do. And again, if somebody is choosing you in particular to open up to, there's a reason. There's some message of safety that they've gotten from you that makes them feel that they can do that.
Right. And I would say preserving that safety of making sure that you don't then pass on any of the information that they share of, yes, my neighbor's son is going through this, that, and the other. And I think it's so easy to if we know of one person and then we know of a second person to sort of reference the other situation. Oh, so and so's daughter is going through that too. We should put you together to chat and put, and this is such a personal,
It's a very private, it's a
say,
very private, if
right,
the couple should get to choose if they want it to be a private journey. And that's really not your choice to,
right.
you
And
know,
if somebody else is making that choice for their child, we can't control what other people do, but we can make sure that we're not part of passing that on and maybe even say, oh, are they, do you feel like it would be a okay thing sometimes to maybe say, are they okay with you sharing that? I wonder what the role would be. It's hard
I
to say,
think you don't want to sort of put
but
any more of an, I'm not sure that that's your responsibility to point out to somebody if they're opening. I think if they're sharing it with you, it's on you not to share it with anybody else. But I
sure,
think you really want to be the supporter and not, I think that would, I think that could shut somebody down.
sure.
If you're, it takes a lot to feel comfortable talking. And if you've done that and someone says, I don't know if you're doing the right thing here, I think that might shut them down. I think, again, you can maintain that privacy and then it doesn't go any further.
Yeah,
So I think
that's a
that's where you can be really, really helpful.
really good point. Yes, for sure. So I feel like we've been talking so much about just like in general, right? Of being a grandparent in waiting and having a child go through infertility. I would love to sort of bring this into the Jewish world very specifically because there's a reason that we have Yesh Tikva and there's a reason that we have grandparents in waiting in a Jewish space because our spaces, you know, can be unique in certain ways around infertility. And I know from my perspective where things have, can be unique in terms of different communal life and Jewish life pieces. I'm curious if anything has come up in the group specifically and just in your work in general, just around Jewish life and being a grandparent in waiting.
I think it's so normative in our universe. There are certain worlds in which if someone doesn't have a child till they're 35 or 40, that's the norm and nobody's thinking about it or concerned about it. But I think in the small world that we live in, the norms are different and they're clear and everybody knows what they are. So when you're not fitting into that norm, you feel sort of all eyes on you in a way, or you might feel you might not. People have different experiences, but I think the fact that the community is in many ways more homogeneous than other communities that people belong to, it makes it harder because it stands out more.
Mm. Yeah, that's a really good point. I would say it stands out. It stands out more with what we would call primary infertility, which is no children in that couple or that individual's life yet, but also with secondary of smaller families if they've had one child and then they're struggling to have a second child, which I think the visibility and the response tends to be a bit different. What I have seen is oh, that's going to be a very big age gap and what's going on there. And, the kind of eyebrow raise of like, is this all what are you doing? Um, and then maybe more in different circles, it would look, like something is going on, consistently. But I'm curious from like a grandparent perspective, have you seen anything with secondary infertility specifically is coming up that might be interesting in a
I,
Jewish?
I think I think it comes up a little bit less, but I think again, the worst thing you can say to somebody is, "Oh, but they have a child." And I think that is a way people try to comfort sometimes. And again, it's not an empathic, comforting response, because if you want another child or more children, it is as painful, it's to you, as it might be to someone who doesn't have children. So I think that, again, being where somebody is and being able to respond to their pain or recognize their pain is the most helpful thing you can do.
I think that's such a good point. I think that goes for, and maybe this is exactly what you're saying, and I'm reiterating, I'm sorry if that's the case, but I think it goes for talking to the person going through infertility themselves, saying at least you have one child, or be grateful for the child you have, because it insinuates, of course, that maybe they're not grateful for the child that they have. But also to the grandparent of, instead of, oh, we'll be happy you have a grandchild. Some people have no grandchildren, can be so painful and really harsh, because again, to say that they don't treasure one grandchild or two grandchildren or more when they know that their child is struggling, or one, and I think again there's an interesting dynamic of people have multiple children, one may be struggling and three may have children, and that's still painful to say, well, I have 10 grandchildren, but my son and his wife are not able right now to have children. You're still in pain for that child. It doesn't, take that away necessarily.
Also an important kind of trouble spot when you have, one of your children is not having, or several of your children are not struggling, and that's happening exactly the same time that you know that your other child is struggling. And how are you able to be joyful for one and still hold the pain of another? I think that's very hard for grandparents in waiting, to give the child who is not struggling their due, so to speak, and be there in their joy while you're still trying to take care of the child who is now maybe in additional pain because it's so easy for their sibling, or because people are saying, things to them. And again, I think people say things with the best of intentions, but when you say to somebody, oh, I'm Yirtzeh Hashem by you, it's such a stab in somebody's heart, that it just adds to the what you're really doing in a way to take away from the pain can add to the pain in a way that you don't intend or realize.
Do you have any sort of guidance around if that is the case for somebody, one of their children is struggling and another or multiple children are not? Um, I think managing sibling dynamics in general as a parent of adult children, and somebody who is not, seems very difficult. Sibling dynamics, I think, are just such an interesting topic to begin with. But, when you're dealing with something like this, especially I would imagine if the younger children are having children and the older is maybe the one struggling. And so they're watching, their younger siblings become parents. I'm curious kind of how you would guide.
I think very gently. I think and I think you can also ask your child, is there something I can do, for you right now? Can I be helpful to you in any way? I don't think it's helpful to say to a child, I'm sure you're feeling terrible right now, because you can't assume what they're feeling, but I think you can let them know that you want to make yourself available in any way, and that you wish you could make this easier. Again, you can't promise that you can. You can't, take away the pain. I think if a child decides, for example, not to go to a bris or a celebration for a niece or a nephew, that's a choice you have to respect. And I know that there are times when parents will put pressure on the couple who's struggling, to do that, and they can't. And I think it's painful to you not to have them there, but I think it's so much about what makes them able to cope and function the best, and just being respectful of whatever that looks like, even if you don't understand it, or it wouldn't be your choice. And it works the other way too. I've heard of parents who have said, look, if it's too hard for you to come to the bris, then you shouldn't come. And the couple will say, what's wrong with you? Of course we're coming. So I think you just can't assume that your reaction is their reaction.
Right. I think coming in with an open mind and giving them then the space to sort of fill it of, I know this is coming up. I wanted to check in how you're doing. And they can say, oh, we're very excited for the bris, and we're looking forward. or they can say, actually, I'm feeling a little overwhelmed by the idea of this. And then you're the liaison in that way of like, you can sort of hold them in whatever it is that they're feeling. And even if they're going and they're struggling, you can also be the person to come over and just give a hug and, say, do you want me to sit with you and things like that. I think that just being a safe person in the room when the room is very joyful and they're carrying, struggle into that room, it can be so meaningful. And like you also just said, of if they have to miss something, whether it's a service, whether it's a bris, a holiday, there can be all different things that kind of just feel too hard. To know that your parent respects and supports your decision can mean so much to an adult child, right? Most adult children want, their parents' acceptance when they're making a hard decision. And to be able to say, we'll miss you and I understand, is as opposed to maybe guilting, by even by accident of just like, really, really, come on, like, it'll be quick or whatever. It can mean so much to just say, I hear you and we'll miss you, but we get it.
I think it's also important for a parent to figure out how to hold the joy and the pain at the same time, because they really can coexist. And it's tricky. It's not so simple to, know that it's sort of okay to be sad and joyful at the same time is hard. It's
Yeah,
hard.
for sure. And I think that that comes up with things like, Mother's and Father's Day and things like that too, of where, you maybe are used to being celebrated with and celebrating with your children, and suddenly the celebration feels difficult for one child. Suddenly is the whole, is it like, are we throwing out the whole tradition of what we do? Oh, we do brunch every year. But now you're struggling. I mean, it can be a lot of uncharted territory to navigate when it felt like, okay, well, we have our traditions, and suddenly those traditions look a little different or feel painful for one child.
I think it's also okay to
Mhm.
ask them. So, for example, if you know that your child is going through a cycle and we're going to the doctor, I think it's okay to say, is it okay if I ask you how it went? And your child may say no. I'll tell you if I want to, and you have to respect that, and your child might say, yeah, my appointment's over at 1 o'clock, I'll call you. But I think it's respectful and okay to ask, to get their permission. Again, not to, I've said it before, not to make assumptions about what's going to work for them.
Right. And also know that what they say today may be different. A month from now, a year from now, they may say, yes, ask me anytime. And what we often see is if journeys start becoming long and there's, years of treatment and years of figuring this out, things can really shift for how much people want to share. I'm thinking of somebody right now who's on a very long journey, and it was originally was very open with everybody, and now it has a Google Doc that she updates with what's going on so that those she wants to know can read it, but she cannot talk about it with them and doesn't want questions, but knows that people want answers. And that's such a thoughtful thing. And also, it's not something everybody would be able to even do that. It may suddenly feel much more private, or it may feel less private. And so, sort of that checking in of, you know, it, I just wanted to see, is it okay if I ask about this still? Or if you notice that they sort of bristle at something they didn't used to, just take note and maybe try to ask about that piece of it.
I think what we're both saying is that you can't make any assumptions.
Right. And that the assumptions change over time, potentially, for sure. Um, I'm just thinking again around maybe back to friendships and circles around there, but just is there maybe specific topics that you would recommend people sort of bring into those spaces if they know that their friend is struggling, and there's a group discussion happening about grandparenthood? Kind of what would be maybe some ideas of things to bring in?
I'm sorry, I'm not sure what you're asking.
So if everybody is sharing about their grandchildren and that you're in a space with somebody who does not have grandchildren yet for a reason such as infertility, what would you sort of recommend they do? Is it to kind of change a topic to, and if so, like what would a good like maybe some other topics, like some.
I've been in groups of people who do have grandchildren who have said to each other, so and so is going to be with us. Let's not show all our grandchildren's pictures. Let's not only talk about our grandchildren. There are still lots of things we can talk about other than that. So again, I think what's so important about something like today is to create the awareness. People are not necessarily aware of this as an issue. If you haven't lived it personally or through, someone close to you, you just sort of don't know about it. And I think, one of the things that Yesh Tikva has really taken on is creating an awareness of this, of this as an issue. I know that the rabbi of one of the shuls that I go to put on his Facebook before Mother's Day, be aware that there are people in our community who want to be mothers and who aren't for whatever reason. And I don't think that had ever occurred to many, many people, because why would it? So I think that sensitivity and awareness and is just really, really important. And yeah, if you can change the topic if people aren't aware, and you can do that in a sort of graceful way, then that is certainly helpful. But again, I think that just being aware is so important and can really take you a distance in this whole journey that people might be going on.
Or I love that they posted that, because also that's just so helpful to bring that thought to folks, because I think that that's really understandable. It's not necessarily coming into everyone's mind. That also brings me into kind of a little piece of, not so much about your own children, but just adult children in your community who maybe don't have children. Something we tend to hear a good amount is, oh, the person at shul, this lady keeps coming up to me, or all the ladies keep coming up to me and asking, why I don't have children. And so I think it extends of, if you are, like you said, fortunate enough not to be in this space with your own children, thinking about the fact that there are plenty of people walking around who are in this space, not just as grandparents in waiting, but of course the people going through infertility, and again, not making assumptions that this is a light topic for them. And so, not necessarily going up and asking people about essentially, their reproductive lives and what's going on for them, but making sure that you still acknowledge that. The only thing to talk about with people is not their children or their grandchildren. So coming in with topics that people can engage with you on.
And I think it's really the same as any other hard topic. It is unique in certain ways, but in other ways it's not. There are many things in our lives or friends' lives that people go through that are hard, and you figure out how to deal with that and how to help them. So it's not, it's different, but it's not the only area in our lives where we, demonstrate a sensitivity or an awareness to people that we care deeply about. And I think if you think about how you would do it with some other topic that you might feel more comfortable handling, the rules are probably pretty much the same, tweaked to be a little specific to this.
I think that's really a really good point, because it often feels like it's appropriate, I think, to ask those kind of questions of your children, of your friends' children, of nieces and nephews, because children are just such an integrated part of the community and our lives, and that, there's always little people running around. And so I think that's such a good point of thinking, remembering that this is not as unique as it may sound. It is common, and also we are all managing sensitive topics around us all the time. This is also one of them. This is not, something that's just not occurring to, it's not typically not occurring to a couple that they, want to have children if they want to have children and things.
It's the same tools that you would use in other areas of your life.
Such a great point. Is there anything else that you want to speak to, Marian? That kind of covers my thoughts, other than
anybody wants to put a question or a comment or a thought in the chat. Okay, so I'm just going to see if I can read this. The question is, Judaism revolves around marriage and children. Whoops, I lost it.
Oh, I don't have anything in my chat.
Okay, let me get that. Judaism revolves around marriage and children. I feel daily pain and think I'm abnormal. Why hasn't it happened to me? Where did I go wrong? Huge guilt that I haven't provided my parents with grandchildren. Any suggestions on how to live a quality life? Thank you for for the question. So I think what I've observed, and again, Kenzie, you'll chime in with your, is that all of those feelings are so normal and expectable and um, hard to deal with. And I think what a lot of people have described to me is this really awful feeling of shame and guilt, as was mentioned. And I think the people who are, I don't want to use the word successful because I don't think that's an accurate description, but I've seen people who really have gone on. I think it's really easy to curl into the fetal position and just feel like if you don't have this aspect of your life in place, nothing else is in place. And I think for people who are able, and I don't say this lightly, it's not easy to still go on in other aspects of their life that they value and not just see themselves sort of as a failed baby machine. There that's helpful. And I think for people who are supporting those people to also still kind of take joy and pride in their child or their friend for so many other reasons that we are proud and joyful about the people around us. That's that's helpful too. And I think who you align yourself with and how your friends respond, and you get to choose your friends and the people that make you feel the most comfortable is important too. You don't have to put yourself in situations that are hard, hard to be in. And there probably are people who are more comfortable than others. Again, I wish I had a prescription for that, but I think it's important to still recognize that you are a valuable human with all the pain, that there are many other pieces of you that are very important, and to the extent that you can focus on that. And then I think, getting support, I think, if you feel ready to do that, then I know Yesh Tikva has support groups, and I think it is helpful to speak to other people who are going through what you're going through, because I think there's a different level of understanding and empathy that they can provide you with, and community that they can provide you with. I think it's sometimes hard to find that community. So, Kenzie, if you want to add to that.
That's it. I think that that's such an important piece. I love that you said, you're not just a baby machine. I think that things can start to feel like that sometimes of, this is what you're not bringing to the table and it's what you're supposed to bring to the table. And trying to stay in touch with yourself as a whole person as best you can. And we have a number of different resources and conversations about how to do that. And again, there's no one prescription. Really, we put a lot out there in hopes that one thing lands with each person at least, with the knowledge that not everything lands with everybody. But yeah, it really, our biggest thing is, you don't have, nobody should be carrying this alone if they don't want to be carrying it alone. There is meant to be, this is a community for a reason. And we're here to, lighten the load in any ways that we possibly can. And that also kind of brings me, Marian, I can't see the chat for some reason. I didn't see that question. Do you have any other
I
questions?
think different people are sending chats to different people. So that's the only one that
That's
I have.
correct. Yes.
And Judy, I don't know if you have anything on your side.
Okay. Well, actually, something just came in, but I can handle it. Somebody wants to know about contact info. Thank you so much for mentioning. We discussed that earlier. With the recording that you'll get later on today, Kenzie and Marian are going to give us, all sorts of other information. There's, I think, a program you wanted to talk about also.
Yes, so Marian's Grandparents in Waiting supportive space. The next one is on June 16th at what time is that?
I think it's 9
9
Pacific time, so it's noon Eastern.
9:30 Pacific time.
9:30? Okay, good to know.
I hope so. That's what it says on our
Okay.
thing. Here, I'm actually going to drop the registration in the chat. anybody would like to go. It's virtual.
But you'll get it again later. If you don't get it now, you'll get it again later.
And
Is
also,
there a limit to how many people can be part of this?
no, no.
Okay,
I mean,
okay,
if we got to that limit, we would just run another group.
okay,
But
wonderful, wonderful.
Kenzie, I think also information for anybody here who might want to know about or share about the support groups, not for grandparents in waiting. That's also
Sure.
important. And just to know that Yesh Tikva has a lot of information on their website that you can scroll through. And as Kenzie said, some of it may hit for you and some may not, but there's a lot there that I think is really a lot of really good resources that they provide.
I'll send those to Judy. We in
Beautiful.
partnership with Marian, we have two different what we call Tikva toolkits, which are written materials with lots of tips and information. And one is very much about how to support yourself as a grandparent in waiting, and one is also about how to hold days of joy alongside grief, specifically really Mother's and Father's Day, as well as simchas and everything else. And so just kind of how to exist in that space. In between. And so I will make sure to get those links over to Judy so they can come your way. And then we also just have a lot of resources for those who are, of course, going through infertility, as well as clergy and therapists and doctors. So if you also are holding some professional roles involved in this work, which so many people are in some way or another, we also have some pieces for you as well in that realm.
Wait. I have two. Okay. Now come compliments. So excellent presentation. We heard. Thank you so much, everybody. It's always nice to know when things are hitting home. Yeah. So that was. I think this definitely has been very meaningful for various people, and for those who aren't on screen will be hearing this later. I think that everybody will definitely appreciate it.
For sure. And we'd be happy to talk to anybody who, maybe didn't have anything to say right now, but we'll, as Judy said, we'll get you our contact information. Yesh Tikva has a support line that you can also make an appointment with if you specifically need resources or you want to pass that information on to someone you care about. But we're here.
Ongoing conversation. It's part of the reason we couldn't do this as a presentation. It's an ongoing conversation, and I hope that people will feel that if there were things that weren't covered today or things that would be helpful, that they reach out. And there's a lot of support out there.
Okay. So anything else you guys have in your chats waiting for you?
I do not.
Okay. Kenzie, you also?
I hope not, but if anybody has chatted me, I don't see it, and please chat Judy or Marian.
No, I think you would see it if there was something,
I tried to also send a chat and it didn't go through to anywhere.
Oh.
So I also may be having a technical difficulty.
Okay.
So
So if anybody, we'll wait another minute, because I don't have anything waiting for me. But I think everybody knows where they can, get the information. We really appreciate it. And it's just been wonderful to know that this is available and to know that you have, a particular support group that people, can connect to. So we will get that up. And I guess that's about it. So as I said earlier, we will not be on next week, but in 2 weeks from now. So you'll be getting all that, and all that information will come in the emails. And I also just want to mention, occasionally people tell me, it happened with someone today, that they didn't get the Zoom link. You should get, whenever you register, the way it always works is as soon as you register, you should be getting that Zoom link. I think it comes from my email, although I don't personally, it's a Zoom thing. If you're not getting it, make sure that you put the right email in. Sometimes you're not getting it because it's the incorrect email, and that's going to be a problem. And you're also not going to get the recording from us. So check always that your email is correct, and also check your spam and your trash because they might have put it there. Whenever anybody registers, I can always send it again, but sometimes it is a problem with your own device. So that's something you should get checked out because we don't want anybody to miss any of our programs. Okay, well, thank you all for joining us. Kenzi, Marian, it's been a pleasure. And we thank Gila for having set everything up. Take care, everybody. And if you have other programs in the future, just get back to us. We'd love to have you come back.
Thank you. Enjoy your
Take
day,
care,
everybody.
everybody.
Take
Have a
care.
great week, and we'll see you in 2 weeks.
Bye.